Hi, my name is Lindsay Mann, and today I'm going to be talking about preeclampsia and going over some general education for the condition. So, I'm going to start with a quick overview and its prevalence, as well as getting into the underlying pathophysiology, some signs and symptoms, how it's diagnosed and managed, how it's prevented, and risk factors, as well as education and resources. So, preeclampsia is a condition that occurs in pregnancy after 20 weeks gestation. It is marked by high blood pressure and multi organ involvement that I'll get into a little bit later. And if it's not treated and managed properly, it can lead to poor outcomes for both the mother and the fetus. It is responsible for around 46,000 maternal and 500,000 fetal deaths annually, which is a lot. And it also occurs in 2 to 4% of all pregnancies. And 5 to 20% of women impacted experience life threatening complications. And this is also a pretty high number. And it's more often occurs when it's developed before term. And a lot of the deaths and the life threatening complications of it are mainly attributed to preeclampsia either not being treated or being mistreated. So it's very complicated, like I mentioned, and the pathophysiology of it is very complex. It's mainly thought to be due to an imbalance between the supply and demand with the mother and the fetus. So the fetus has increased demands for nutrients and oxygen and blood supply, and the placenta is not able to keep up with that, and the blood supply in the placenta is decreased. So this imbalance leads to the release of syncytia trophoblast derived factors like pro-inflammatory cytokines and excess placental debris, which then leads to a further imbalance with angiogenic SFLT1 or SFLT1 and placental growth factor. And SFLT1 is really important because it's a protein that inhibits the formation of new blood vessels, and this is extremely increased in the setting of preeclampsia. You also see systemic endothelial dysregulation and inflammation, which leads to a lot of the systemic and organ involvement within preeclampsia. This chart just kind of goes through exactly what I had explained. You could follow along at the top of when you develop preeclampsia, and it shows the disconnection between the fetus demands and the uteroplacental blood supply, and then kind of explains everything that is released and how that all impacts a person systemically. So, signs and symptoms, hypertension is the main sign and symptom. I'm going to get into the labs and how it's diagnosed and defined a little bit later. But generally, hypertension, systolic greater than 140 millimeters of mercury or diastolic greater than 90. A lot of people see neurological symptoms. Headaches is the big thing. They're often described as being pulsatile and they're unrelieved with medication. People see tension headaches, they see migraines with or without aura. They may also see visual disturbances like blurry vision and floaters, mainly due to retinopathies that can develop because of the vascular changes. You can see pulmonary edema, which manifests as diminished lung sounds at the bases. And this is pretty rare, but it's a pretty important complication to catch. Um, it can be due to increased vascular permeability using tocolytics or corticosteroids, iatrogenic volume overload, and cardiac dysfunction all kind of combined. There's also fetal growth restriction. So most of these babies often weigh under the 10th percentile for their gestation. And this is due to placental insufficiencies and the decreased vasculature. And then eclampsia is kind of the exacerbated stage that if the symptoms and the signs aren't treated properly, it will escalate to. So you'll see tonic-clonic seizures, focal seizures, multifocal seizures. And like I said, it's mainly due to the edema, the endothelia changes, the high blood pressure, all not being treated and all kind of coming together in severity. And then there's also just some general systemic changes you might see. So, like electrolyte deficiencies, like low calcium, renal compromise, cardiomyopathies, edema of the hands, face, feet. And a lot of these can be exacerbated if you have underlying chronic conditions. So the diagnostic criteria, so ACOG, the American College of Obstetrics and Gynecology, currently defines preeclampsia as gestational hypertension after 20 weeks gestation with multi-organ involvement and proteinuria. So they define the hypertension part as two blood pressure readings within 4 hours of each other, measuring a systolic of at least 140 and a diastolic of at least 90, one or the other. And proteinuria, they define as being at least 300 milligrams in a 24-hour collection, a PCR greater than or equal to 0.3, or a dipstick of +2. And the multi-organ involvement is kind of subjective. Some people say you need to have multiple of these. Some people say you need to have one. It kind of just depends on the diagnostic criteria you're looking at. But multi-organ involvement can look like serum creatinine greater than 1.1, liver transaminase elevated twice the normal levels, cerebral or visual changes, thrombocytopenia, or pulmonary edema. For managing it, first off, if somebody has severe range pressure, so greater than or equal to 160 over 110, they're going to require immediate treatment within 30 to 60 minutes. So often IV hydralazine, IV labetalol, or oral nifedipine or a combination. And when people aren't able to manage their blood pressure throughout the pregnancy, they're often put on oral antihypertensives. So nifedipine is the most common because it's safe during pregnancy. As well, they may give magnesium sulfate through IV if there's more severe range pressures or there's new onset of headache or blurry vision or any more severe symptoms that may be leaning towards the eclamptic stages. And they give this a lot in the postpartum period because it can slow down contractions. So it's not always given before delivery unless it's indicated. As well, diuretics such as furosemide are useful in treating it. By helping decrease the demand on the vasculature and helping relieve the hypertension. As well, delivery is the big thing that often people see relief with the hypertension and symptoms. They may recommend you deliver at 37 weeks via C-section or that they induce you. They may recommend sooner. It all just kind of depends on the condition and also underlying conditions as well. It is important to know that preeclampsia can also persist past delivery and it can also develop within the postpartum period. If it does, it often develops within the first 48 hours after delivery. So it's important to know that delivery is not necessarily like a catch-all of that it's going to get rid of your preeclampsia. So there's no specific way to prevent preeclampsia, but there are some risk factors that are modifiable. So risk factors include obesity, diabetes, any underlying chronic hypertension or history of preeclampsia, any other chronic underlying diseases that involve the kidneys, the heart, autoimmune, nulliparity, multiple gestation, all different things like that. And while you can't modify all of them, you can kind of help fix some of them. So like with obesity, maintaining a good healthy weight before pregnancy. If you have chronic conditions like diabetes, hypertension, chronic kidney disease, making sure that you talk with your provider before you get pregnant if you can, about your risks and trying to just manage those conditions and get them kind of at bay and as healthy as you can before you get pregnant so that your risk of systemic complications is decreased. Into some education and resources. So women who receive education at the time of their diagnosis have been shown to be more compliant in modifying their lifestyle and also have better outcomes with preeclampsia. So knowing when to call your doctor if you have new or worsening symptoms, if you have increasing blood pressures that aren't resolving, consulting with your doctor about any prior conditions and complications, maintaining and increasing your physical activity as tolerated throughout the pregnancy. Learning ways to help cope with stress can be super important, especially in helping to lower your blood pressure. So like getting adequate sleep, doing things like reading or new hobbies. Aromatherapy can be helpful with stress. And making sure you get a blood pressure cuff to use at home. They usually recommend 1 to 2 checks a day, but that could depend on your condition. Making sure you know and are familiar with how to use the cuff, that you have to be sitting, that you should be relaxed just to get the best reading possible, as well as ensuring medication compliance. And finally, I just wanted to provide some resources. The Preeclampsia Foundation is kind of the guide of all things preeclampsia. They have resources, they have support, they have different research and current practice standards on their site, and they're kind of a great general resource to use. The American Heart Association is great too. They have a lot of e-modules that you can go through in terms of heart health and how that changes in pregnancy and how you can modify your lifestyle based on that. And WIC also provides resources specifically for people in lower socioeconomic status that may take part in the WIC program. They offer tip sheets and advice on how to use the WIC program to your benefit with preeclampsia and pregnancy. And that is all. Thank you.